If one of your healthcare providers is a nurse practitioner, chances are pretty good that they were trained here in the Valley at UND.
Valley News Live's Ashley Bishop is live at UND this morning, where the nurse practitioner program is celebrating a very big anniversary. Ashley?
Good morning, Kyle and Lisa. Yes, the program here is celebrating 20 years this year, which is big. Both of the ladies joining me right now are graduates from the program, and family nurse practitioners are important in our healthcare system. Jackie, talk to me about, we've heard reports that there will be maybe a doctor shortage, so family nurse practitioners are important in the healthcare role. Why?
Sure. Well, nurse practitioners have always been trained to assess patients, interpret diagnostic tests, and treat patients according to their conditions. So nurse practitioners use evidence-based practice to guide their practice, and we have really good outcomes as far as patient satisfaction. So as our population ages, as more patients are accessing healthcare due to the Affordable Care Act, we really find a need for nurse practitioners to fill that role with patients that may need access to health care. So that might be in rural areas, or it may be the most underserved patients that need health care.
And doctors and family nurse practitioners, they're not going to compete against each other. They're just there to help fill the void, right?
Right. So nurse practitioners, I feel like we work in partnership or interprofessionally with all healthcare providers. So that includes physicians, dietitians, social workers, physical therapists. We all work together to really provide the best outcome for patients, and especially here in our state, in some of the most rural areas.
Okay. As I said before, both of the ladies joining with me right now are graduates of the program here, and they also teach in the program now. Stephanie, why did you come back to wanting to teach here, and what do you love about teaching family nurse practitioners?
I think the excitement of students who are really motivated and see the need in the community. They want to return to their communities and continue to see, high-level care provided in North Dakota and in the region, which is really an issue for rural areas. And so that kind of excitement is fun to be around and fun to be a part of.
Now, there are 600 family nurse practitioners in the state of North Dakota, and that seems like a lot, but when it's, I guess, dispersed across the state, is there, do you think, still a need for more?
Oh, definitely. They're very much needed in rural areas where we're looking at access to primary care. As we see the aging population, a lot of people are faced with extensive travel. And that can be difficult, if not impossible, for them to access care. So that is necessary, as well as even in the larger centers, to extend specialty care.
Okay. Coming up, we'll talk to you next about there's a great event that they're doing to celebrate 20 years. Family nurse practitioners, the program here has been around for 20 years, and it's only been around for 50 years, which is hard to think as a whole across the nation. But coming up, we'll tell you about this great event that they have coming up. Kyle, Lisa?
Ashley Bishop reporting live for us this morning. Thank you, Ashley.